folks that we are being recorded, so if you could please state your name when you first speak. That will help us for record-keeping purposes and to follow the conversation. And if you are not speaking, if you could just try to stay on mute so we can avoid background noise and any distractions, that would be great. And with that, Melissa, why don't I ask you to take attendance and confirm our quorum?
Sure. Claudio Gualtieri.
Here.
Robert Boris. Teresa Charmchi Goodwin. Aisha Clark. Ann Foley.
I'm here.
Samuel Hahn.
Here.
Tony Harp. Cindy Harrison.
Here.
Stephen Hernandez.
Steve Hernandez here.
Suchitra Krishan Sarin.
Here.
Matthew Jasinski.
Present.
Commissioner Manisha Jutani.
Present.
Christopher Moran.
Here.
Michael Rell. Trisha Orozco. Andrew Salner.
I'm here.
Yep, we're all set, Claudio. You have quorum.
Thank you. I'll also just introduce, because I think this may be the first time that, in addition to Melissa, who everyone on the team already knows, we have Sharika Rose from the OPM team who's joining us and has been so helpful. She has expertise in working with a lot of nonprofits and grant making through our nonprofit grant program. And she's been willing to sort of step up and also provide some help and support, and is interested in the tobacco cessation work. So Sharika, welcome, and thank you for being part of this team.
Thank you, Claudio. Hello, everyone.
And then that brings us to the next agenda item, which is the adoption of the January 22nd, 2025 meeting minutes. I think everyone received those minutes shortly after our last meeting, and you should have also received them again as a reminder when we sent out the notice for today's meeting. Has everyone had, well, I'll actually pause for a motion to entertain the minutes, and then we'll have any discussion or need for any potential corrections. Do I have such motion?
So moved.
Dr. Salner, thank you. Motion to approve. Do I have a second?
Second.
Second, Representative Harrison, thank you. Motion is made and seconded. Any discussion, requests for edits? Seeing none, Melissa, should we just approve on a voice vote? Can we do a voice vote for this one?
Yes, that's fine.
All those in favor of approving the meeting minutes from January 22nd as submitted to the board, please signal by saying aye.
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 Any opposed? Any choosing to vote present? Seeing none, the meeting minutes are adopted. Thank you. Third item for today's meeting, I just want to recap what we're going to be talking about substantively and the goals and objectives of today's meeting. We'll start out with an update from Commissioner Jutani and DPH on the current Tobacco and Health Trust Fund account status, the interest earned. I think Melissa may have the update on the numbers there, and then we'll go right into an update on contract development for the FY23 tobacco dollars and the RFP process for the FY24 allocation that was approved by the legislature. The board has also asked for some presentations related to an update on tobacco smoking generally, the use of ENDS in Connecticut, and we all thought that it would be a good level set to have a state of play of where smoking, tobacco, and nicotine use is in Connecticut as we continue to think through interventions and investments in our work. So we've asked, and DPH has kindly provided some staff with subject matter expertise to review the most recent Youth Risk Behavioral Survey and Behavioral Risk Factor Surveillance System, the BRIFIS data. And we will then conclude by outlining some next steps for our tobacco topics and some public comment. And I'm hopeful I do see some key advocates and stakeholders from the public here. So I invite them to also share comments during our open public comment period at the end of the meeting. With that, I will turn briefly to Melissa. Melissa, if you can give us an accounting of the balance on the Tobacco and Health Trust Fund account and interest earned.
Sure, happy to. So on the screen, and this will be sent to everybody after the meeting and posted online. As of March 31st, you will see that the Tobacco and Health Trust Fund has actually allocated out to the community $26 million, which is wonderful. That includes the two $12 million allocations that we received in 2023 and 2024, plus the inclusion of some balances that were left remaining in the account at the end of 2023 from just historical projects that either didn't fully expend or never got off the ground, plus interest earned in 2024 through September 30th of 2024. And then we had one final little period of interest that got in there, the $178,000. So that left us, as with our last approved allocation plan, was $14 million, $14.2 million, and we were able to have that allocation plan approved and all those funds go to RFP. So that now means that we have allocated the full 26 million that was available to us in the time that it took to transfer such, the funds stay in our account and accrue interest while we wait for DPH to go through the RFP and contracting process. And then eventually OPM will transfer the money over to DPH so they can pay the grantees. In the meantime, while that money is in our account, it's collecting interest. And so we now have an unallocated account balance of $556,920.20 that accounts for interest earned from October 1st, 2024 through March 31st of 2025. Interest earned prior to that was included in the $14 million that we were able to RFP out through our last allocation plan. So this is the only unallocated balance that the board currently has is interest earned on funds that have just not yet been transferred over to DPH. That is the full report. And if anyone has questions, I'm happy to answer. Yes.
Yes, I have a question,
Sure.
Melissa, and then I know Ann has too. So just for a point of clarification, since these funds are encumbered but not yet expended, they will continue to earn interest. So the period that we're allocating here of $265,000 in interest through the end of last month, because the RFP process is still not underway for the FY24 dollars, that pot of money will continue to earn interest, and anything that is pending contract execution and payment at DPH. So we're going to continue to build potentially a sizable pot. Is that correct?
That is accurate.
Cool. Thank you.
You're welcome.
Ann.
Thanks, Claudio, and thanks, Melissa, for that report. My question is, and maybe you covered part of this in our last meeting, but can you tell us and give us the citation for what the governor's budget proposed with regard to the trust fund? And also now, I think the appropriations budget is out, if there was something that they proposed with regard to the trust fund.
I can take that, Melissa.
Sure.
So the governor's budget proposed keeping intact the $12 million deposits in each of the 2 years. So we did not we did not change the amount that was anticipated to be deposited. It would be $12 million in FY 26 and 12 million in addition for FY 27. The Appropriations Committee did report yesterday, but recall this is a revenue option because it's a transfer from the trust that gets deposited. So we'll have to wait to see if finance reports as part of its revenue package any change in the deposits. I suspect they will report tomorrow. Their deadline is the end of this week. So we'll have clarity. If they don't report, then the status quo, the current services estimate would be the 12 million. So without intervening legislative action, the governor's position of 12 million being deposited would remain the operating assumption moving forward.
Great, thank you. And that usually comes in, doesn't that usually come in April? When does that come in?
Yes,
April.
so the April one was suspended for this year though. So that's why we were catching up. So as part of the last year's budget, we suspended the deposit that would have happened this April, but good point.
So we will not get another deposit for a year next April, because I thought yeah. So next April
That's
will
correct.
be the next deposit. Okay.
But and you'll hear about this with DPH, is we still have not gone out to bid for the $24. So we're pretty much on cadence with monies going out to the community on an annual basis. It's just we won't do another allocation plan because we did 2 allocation plans in very quick succession to catch up.
Okay, so then I guess that raises another question for me. We have not gone out to bid with some of the money, but it looks like the total, everything has been encumbered. So I guess my question is, what then does encumbered mean?
Let me clarify. It did go to bid. It's just and it's been awarded out. It's just the contracts haven't been executed yet.
Okay. Okay. Thank you.
So you'll see the next part of this will be the full presentation on where we are with the fiscal year 23 contracts and where we are with the RFP process. But the RFP process for 24 funds concluded and the total sum was awarded out or
Okay.
will be awarded out. Yeah.
But looking forward, the bottom line is we won't have any new money for a year.
Right, because we need a catch-up year to get all of these in 1 year's time. We have put out $26 million. So we need to let DPH kind of catch up, get those contracts in place and do some evaluation of what we're funding. And then so we're taking a pause this year, then the next allocation, if all remains the same, if I'm understanding Claudio, the next allocation would be next April 1st, so nothing this April and then next year.
Thank you.
Correct. The deposit would be next April, April of 26 in FY 26. That would be the dollars that come in, and we would probably do an allocation plan in the fall. So I think we're going to get on that traditional cadence of maybe October has been our goal. So we're going to try to stick to those October fall submissions to the legislature. So that would be the fall of 26. Representative Harrison.
Oh,
There we go. Thank you so much for this. I have 2 questions, both for clarification. One is we continue to earn money until the funds are actually expended out the door as opposed to just encumbered. Is that correct? Perfect. And then we have a line here for $604,000 de-obligated balance of historic funds, and it says it's pending. Maybe you covered this before, and if you have,
No,
I apologize, but can you clarify what it is?
Yeah, and I apologize. It shouldn't say pending. That I meant to remove. So there you go. It's updated now. It is that we've already incorporated that $604. That's a historic balance from money that was transferred in previous iterations of the board and projects that were funded. and the money had been transferred from OPM to DPH in order to fund projects, and the projects either never got off the ground or underexpended. So that money was deobligated and came back to the trust fund, and we actually then obligated it again as part of the $14.2 million that we was part of our FY24 allocation plan, and all of that money has gone out to RFP.
Perfect. Thank you for the clarification.
Sure, you're
Wonderful.
welcome.
Wonderful presentation. Thank you.
Great. Seeing no more questions, it leads us perfectly. It tees us up for Commissioner Giuliani's update on where the monies are in terms of contracting in the DPH process. So over to the Commissioner.
Thanks very much, Claudio. And somebody will share the slides for me. Thank you. So Claudio and Melissa, you can correct me if I'm wrong, but I'm going to start just with an overview, which is that I'm going to start with talking about FY23, where vendors have been identified, contracts are in process. Then I'm going to talk about FY24, where, to be clear, the RFP process happened, is complete, and the final identified vendors are being identified by May. In a normal cycle as to what we want to be able to get to, Claudio, my understanding is for FY25, in theory, we would have had a deposit on April 1st of this year to be able to then make plans. But because we have a lot of money that we're going to be talking about what we're doing with, there will be no FY25 plan, and that for FY26, in April 1 of 26, a deposit will be made. And we can talk about when the cycle for RFP, et cetera, should happen for that FY26 deposit, whether it's this October of 25 or October of 26. So I think that's sort of the overall view of where we're going. Does that sound correct, Claudio?
Yes, Commissioner, that's right. The only slight amendment is you're right. April tends to be the deposit time because of how it has to get posted and the comptroller ultimately has to deposit it into account. There's some mechanics behind the scene that needs to happen. So it practically happens towards the end of April, but yes, you are right on.
Okay. Okay, great. So, I mean, I think in terms of the work of this group and when we would be talking about an additional allocation, I think the question I just had in my own mind is that in October of 25, can we be planning for the deposit that will come in April of 26? So why don't I start with FY23, which is, again, funding that was approved by the legislature to remind everybody where we stand. There are these 5 different components that are recommended by the CDC as best practices for a successful tobacco control program with recommended percentages of allocation, which was approved by the board. So component 1 is state and community interventions at 35%. Component 2, mass reach health communication intervention at 12%. Cessation interventions at 40%. Again, the quit line is part of cessation intervention, something that we've talked about and had a presentation on the last time. Surveillance and evaluation being component 4 at 9%, and then infrastructure administration and management at 4%. That is the entire 12 million. That process was concluded in January of 25. So next slide. Just to explain sort of the process, that process was completed in January. And in general, I just wanted to describe the contracting process that happens. So the first step is that we need to negotiate contract language with contractors. Sometimes this is more in-depth, sometimes it's less in-depth based on the expectations of the contractor. The next step in terms of box 2 is the program actually drafts that contract language. In step 3, we work with contract support unit that's within DPH and DPH legal to obtain approval of the language that is identified for the contract. those 3 steps take anywhere from 2 to 4 months. Sometimes it's very quick because the contract language very much mimics the RFP and it's very clear. Sometimes it's a little bit more in detail. So 2 to 4 months is what we anticipate for steps 1 to 3. For steps 4 through 7, we anticipate 2 to 4 months. The upper end really is 4 months. That is OPM best practices for that stage of the evaluation of a contract. Step 4 is the submission of that contract to the contract management section within DPH for processing, which also includes OPM approval and budgetary entry. Step 5 is the initial request for signatures. Step 6, the contract undergoes review by the Attorney General's office. Why is this important to just highlight? This is a purchase of service by the state. The state is purchasing services from a contractor, and this is protecting the interests of the state. So the Attorney General's office, OPM, really wants us to make sure this language is as protective as possible for the state, which is why all these state steps do take time. And then step 7 is rooted for final signatures. So if we look at the entire process, we're looking at 6 to 8 months, but we really look at an anticipated timeline of 8 months. And so I just highlight again for you that this process started in January of 2025 for the contracts that we will be executing for the FY23 money. Next slide. So as a reminder, we talked about all of these the last time that we met. At that time, we had just identified who the various vendors were going to be. And since we last met, we've been going through that process that I just showed in the previous slide. So for vendors 1, 2, and 3, so this was component 1 for the first 2 and component 1 and 3 for the third vendor, the program staff is working on that contract language. So that's box 2, that second box. And all of these contracts are sort of in a rolling fashion. So these 3 are in the earliest stages. The next slide are those that have made it much further along. So if we look at the next, vendor 4, which was covering components 1 and 3, that one, the contract language is complete, so it's in box 3. It's awaiting final review by our contract support unit. So basically the rest of these are in box 3. We've started that 4-month, or we're about to start that 4-month time window, making it to step 4 in that box. So you can see that for the rest of these, we are sort of in that box 3 level, going to that final 4-month time period. So what we are looking for is a September 1st start date for the first potential contract that will be ready, but all of these are being done in rolling fashion. So we anticipate the rest to come thereafter, but the earliest start date we're looking at right now is September 1, and they'll continue to be approved on a month-to-month basis as they make its way through. Next slide. So now going to that next bucket of money, which is the FY24 money. So as a reminder for everybody here, the last time we talked about this, we had talked about whether there were any recommendations on any changes we wanted to make here and what the allocation was going to be. So there was recommendation by the board to slightly modify the allocations for each of the components. So different than what we did for FY23 for component 1, which is state and community interventions, it was reduced from 35% to 30%. For number 2, which is the mass reach health communications, it was reduced from 12% to 10%. All of this was done in order to increase component number 3, cessation interventions, which went from 40% to 48%. Out of that, $2 million was committed to the quit line. So the amount of money available for the RFP was $2 million less in the cessation intervention category because $2 million had been put towards quit line already from this particular plan. For component 4, it was slightly reduced from 9% to 8%. And then for component 5, it was slightly reduced from 4% to 3%. And that gives us the $14 million that Melissa was presenting on her Excel spreadsheet in terms of what was available for RFP that went out. Next slide. So prior to the release for the RFP at the last meeting, I had asked if there were any other suggested feedback or changes at the conclusion of the meeting. We did not receive any other feedback after the meeting was concluded. However, at our meeting in January, there were some changes that we proposed and that we had discussed in the meeting that were incorporated into the way that this RFP release occurred. So the first was that proposals were to be focused either on component 1 or 3 and not both. And so multiple proposals were also not going to be allowed. So in this round, people were only allowed to submit proposals for component 1 or component 3, not both. We also got rid of a letter of intent that was no longer required. We learned from the FY23 process of a number of clarifications that people had. So we published Q&A in advance that minimized the number of Q&A that came out after the RFP release. And so that was very helpful in terms of clarifications that we were able to provide. We also updated the BRFSS and YRBS data to reflect the 2023 statistics, which we will be reviewing later today. And then we also recommended to the RFP review committee to fill gaps in service areas that were not included in the FY23 selected projects. So that was something that had been brought up in our meeting, and that was incorporated and recommendations given to the review panel to try to fill areas of gap that had not been filled by the funding allocation in FY23. So some of the revisions that we intended to do for the RFP review process included that we intended to have it be that all review panelists review and score every eligible proposal. We also intended that all review panelists attend all scheduled review meetings, which we intended to be in person, but if possible, but virtual was also going to be offered as well. Next slide. So the RFP was released on March 3rd, again, for the two components that we identified, 1 and 3. The proposal deadline was April 3rd. As a reminder for why the components 1 and 3 were identified is because since we had just gone through this process for FY23, the decision was made by the trust fund to be able to allocate percentages as identified for those identified vendors for the other components already. So the new money was really looking at components 1 and 3. The proposal deadline was April 3rd. 12 proposals met the minimum requirement to move forward by review by the screening committee panel. There were 8 proposals for component 1, which is state and community interventions, and there were 4 proposals for cessation intervention. The panel meeting was held on April 15th to rate proposals, and the goal is for May 5th for final contractor selection. Just as an additional note, before contracts are signed, it is OPM best practice for us to not identify specifically who the contractors will be. So that's why we are specifically reviewing them as vendors. But the contract selection will be identified at May 5th, after which we will start that same timeline of executing contracts for this new group of awardees. Next slide. So that is the conclusion of the 2 fiscal year plans that we have, and I am available for any questions that you may have.
Thank you, Commissioner. That was a very thorough and excellent recap. Appreciate all the work that the DPH team is doing to help make sure this money goes from a theoretical concept and a plan to actually getting into community. So thank you for closing that loop. Suchitra.
Thank you.
Yes, thank you, Commissioner. That is a very nice overview. Thank you for that. I just had one question. In the 24 allocation of the 6 million or so that went into cessation, you said 2 million was put towards a quitline. does that come out of the 6 million? So reducing that
Yes.
to 4? Okay, all right.
Yeah,
Thank you.
that's why the total money that actually is going to components 1 and 2 is 9.2 million roughly. So component 1 in the table that I showed you was roughly 4.3 million, and component 3 was roughly 6.9 million. So this was the math I was doing before this meeting, was I wanted to confirm what happened to those 2 million, and confirmed that it is the what we already allocated to the quit line.
Okay, thank you.
Any other questions from the board? Seeing none, we're going to ask DPH to do an encore for us. I think it's a different subset of DPH experts, but I'll let the commissioner introduce who from her team is going to take us to the next agenda item, which is a review of the survey data.
Thank you very much. So just as a reminder, in this body of work that we have at DPH, Deputy Commissioner Lisa Morrissey, who is out on an extended medical leave right now, oversees this work. Julie Vigil is the branch chief over this work. Allison Sullivan is the supervisor overseeing our tobacco work, all of whom are on this call to be able to answer more detailed questions. But Shruti Abrapudi is an epidemiologist who specifically did the analyses on the 2 surveys that we're going to present data on today. So the rest of us are available here as well after she presents the data to be able to help translate anything, if anything gets lost in translation. But we're going to let her present the data because she really did these analyses, and we'd like to give her that opportunity to be able to translate that data that we get from those surveys from our youth into how we can actually make use of them in a practical way as a trust fund. So at this point, I will turn it over to Shruti, who will do that presentation for us.
Thank you, Commissioner. Good morning, everyone. My name is Shruti Abrapudi. I am an epidemiologist too at Connecticut Department of Public Health. I'm now going to present Connecticut adults and youth risk, youth data on tobacco data and trends. We used 2 major surveys for tobacco data and trends. They are BRFSS and YRBSS. BRFSS, also called Behavioral Risk Factor Surveillance System, is an annual health-related survey which completes 400,000 adult interviews nationwide. All the adult data that is presented here is from BRFSS. And the second survey is YRBSS, also called Youth Risk Behavioral Surveillance System. It measures health-related behaviors among high school students in grades 9 through 12. The youth data that is presented here is from YRBSS. 4 main tobacco usage patterns are presented here. They are tobacco data, cigarette smoking use, cigar use, e-cigarette or other electronic vapor product use. Tobacco use. Overall, the rate of adult current tobacco use is 17.1%, representing approximately 465,000 adults. Men are significantly more likely than women to use tobacco. Current tobacco use is significantly higher among adults aged 18 to 34 and 35 to 44 than among those aged 45 to 54 and 55 plus. We see tobacco usage rates are almost similar across all racial groups from 16.9% to 17.7%. Tobacco use among youth. Overall, the rate is 12.7% and it represents nearly 19,800 high school students. Females are significantly more likely than males to use tobacco. Current tobacco use is significantly higher in grades 10, 11, and 12 than in grade 9. It means students in higher grades are using more tobacco. Because of small sample size, comparisons by race and ethnicity are not made here. Overall tobacco usage trends among adults and high school students looks like this. For adults, tobacco use decreased significantly between 2015 and 2023 from 19.9% to 17.1%. However, there was no significant change between 2022 and 2023. For high school youth, there was no significant change in the rate of use between 2015 and 2023 or between 2021 and 2023. The next would be cigarette use among adults and youth. Among adults, overall the rate of adult current cigarette smoking is 8.4% and it represents approximately 226,000 adults. Men are significantly more likely than women to use cigarettes, which was 10%. Current cigarette smoking is significantly higher among adults aged 35 to 44 than among those aged 45 to 54. Because of small sample size, comparisons by race or ethnicity are not made here. Among youth, the overall rate of current cigarette smoking is 3%, representing approximately 4,700 high school students. Because of small sample size, comparisons by race and ethnicity are not made, and also in sex, grade, and race and ethnicity. Percentage of adults and youth who currently smoke cigarette trends from 2011 to 2023 looks like this. For adults, the rate of cigarette smoking decreased significantly between 2011 and 2023 from 17.1% to 8.4%, but it did not change significantly between 2022 and 2023. For high school youth, cigarette smoking decreased significantly between 2011 and 2023 from 14% to 3%, and increased significantly between 2021 and 2023 from 1.3% to 3%. Cigar use among adults and youth. Overall, the rate of adult current cigar smoking is 4.6%, and it represents approximately 120,000 adults. Hispanic adults are significantly more likely than their white counterparts to smoke cigars. Because of small sample size, comparisons by sex, age are not made. Among youth, overall rate of youth current cigar smoking is 2.6%, and it represents approximately 3,900 high school students. Because of small sample size, comparisons by sex, grade, and race and ethnicity are not made here. The trends of cigar use looks like this among adults and high school students from 2015 to 2023. For adults, the rate of cigar smoking did not change significantly between 2015 and 2023 or between 2022 and 2023. Whereas for high school youth, cigar smoking decreased significantly between 2015 and 2023, which was from 4.5% to 2.6%, and increased significantly between 2021 and 2023, taking it from 0.7% to 2.6%. Last but not the least, e-cigarettes or other electronic vapor products usage among adults and youth. Among adults, overall the rate of adult e-cigarette use is 6.2%, representing approximately 166,000 adults. Men are significantly more likely than women to use e-cigarettes. Adults aged 18 to 34 are significantly more likely than those aged 35 to 44 to use e-cigarettes. Because of small sample size, comparisons by race and ethnicity are not made here. Among youth, overall, the rate of youth current e-cigarette use is 11.5%, and it represents approximately 16,600 high school students. Females are significantly more likely than males to use e-cigarettes. Students in grades 10, 11, and 12 are significantly more likely than those in grades 9 to use e-cigarettes. Because of small sample size, comparisons by race and ethnicity are not made here. The trends in adults and high school students from 2013 to 2023 in e-cigarette usage or other electronic vapor products usage looks like this. For adults, the rate of e-cigarettes increased significantly between 2013 and 2023 from 3.7% to 6.2%, but it did not change significantly between 2022 and 2023. For high school youth, e-cigarette use increased significantly between 2013 and 2023 from 5.3% to 11.5% and did not change significantly between 2021 and 2023. To summarize, in 2023, 17.1% of adults and 12.7% of high school youth currently used some form of tobacco, including cigarettes, cigars, e-cigarettes, smokeless tobacco, and hookahs in Connecticut. Since 2015, tobacco use among adults has decreased significantly, whereas among high school students, the rate of use has not changed significantly. Among adults in 2023, cigarettes were the most prevalent form of tobacco used. Among high school youth, e-cigarettes and other electronic vapor products were the most popular tobacco product. For both adults and youth, current use of cigarettes has decreased significantly since 2011. Among adults, it decreased 51%, and among youth, it decreased 79%. Whereas in 2023, cigars were the second most prevalent form of tobacco used by adults. The rate of cigar smoking has not changed significantly since 2015. For both adults and youth, e-cigarette use has increased significantly since 2013. To summarize, these findings highlight the need for continued prevention efforts and targeted education, especially for youth and young adults. Thank you for your time and attention, and I'm happy to take any questions or hear your thoughts.
Thank you. That was fantastic. And I see you already have a question there from Dr. Salner. Doctor.
Thanks, Claudio. Shruti, thanks so much for that excellent presentation. Quick question. Did you capture data on people who use more than one type of tobacco? And were those individuals, how many, and were those individuals counted twice as users or counted once by their predominant form of use?
So 17.1% of Connecticut adults aged 18 years and older reported using some form of tobacco, and some form of tobacco includes cigarettes, cigars, e-cigarettes or other electronic vapor products, smokeless tobacco and hookahs, and some days or every day. For adults, the usage patterns need to be more than 100 times at least to be considered as some days or every day. For high school youth, more than once, using only once or more in the past 30 days is considered as current usage. And for adults, it's 17.1%, and for youth, it is 12.7%.
So I think specifically, sorry, if I just clarify for me, Shruti, if this is correct, the subset data that you presented after that on cigarettes, like each of those individually, they would be captured in that subset and in the overall of you used any one of the following. Is that correct?
Yes.
Yeah,
yes,
so I think for Dr. Salner, does that answer your question?
Yeah, I was just curious to know, did you capture data on how many people may have used more than one form? Greater than the 1 day or the 100 days, and what percentage of people used more than one form of tobacco?
Yes, the tobacco use encompasses more than one form of tobacco use, and the individual data that I presented after tobacco use, they are individual sections: cigarettes, cigars, and e-cigarettes. But the first one that I mentioned was tobacco use, and it includes more than one form of tobacco.
Thank you.
Yes, thank you.
But I don't think there's a question that specifically says, did you use multiple forms? Like you might have been in each of the categories, but I don't think there's a question that specifically says, did you use multiple? Do you know, Shruti?
No, Commissioner Jitani. Yes, that's correct.
So some people may have been counted twice.
May have, yeah.
Yes,
yeah.
yes.
Okay, thank you.
Thank you.
Stephen Hernandez, I have a question.
Thank you so much, and thank you, Shruti, for that really thorough presentation. You know, I'm fascinated by the phenomena of kids and youth the prevalence of girls using tobacco products and how that switches into adulthood, into the prevalence of men using tobacco products. So I'm wondering if we have any more detail on that phenomenon and whether it is a trend line. And then the other thing that I wonder is, I'm really fascinated by those points in time where we have dips in usage and what may have been co-occurring at the time to cause those dips, whether it was perhaps educational initiatives, whether it was some other type of impact, and how it is that we learn from those dips. So again, thank you for the presentation.
Thank you very much. So yes, the dips in the presentation might be from, we are understanding that COVID might have a bigger impact on the usage patterns, changing from the regular cigar usage to electronic usage these days. And the trend has changed from conventional usage patterns having cigarettes, cigars to electronic products more and more in 2022 and 2023. And that dip might also have come from COVID usage before and after COVID. And yes, and other than that, there was also another synthetic form of cannabis usage, which was also maybe related to the tobacco usage patterns, and co-use was also significantly high among high school students, and it was nearly 67.9% of cannabis and tobacco co-use patterns in high school students. So that might also have its effect on the usage patterns and the dips in the rates of tobacco usage.
And
And
if I could also, oh, sorry, Sruthi, I just want to interject that the dips for youth were occurring consistently in 2021, which we could make a correlation to COVID and the fact that there was still, that survey would have been given in 2020 and 2021 year when a lot of people were still doing online learning. And so it was a little tougher to administer the survey.
Yeah, just one other thing I wanted to add on that is that the survey, the YRBS was delayed, I think, by 6 months during COVID and not administered at a number of the schools. And then there were a lot of challenges also in getting the survey completed. Since then, there was a law passed in Connecticut saying that if you're selected by the CDC as a school to participate, that you will administer the survey. An individual student can opt out of the survey, but the school has to administer it. So those were some of the changes that we put in place to try to keep eyes in a continual fashion to try to establish those trend lines.
Thank you.
yes.
Suchitra?
I
I
was
messed up again. Correct me again on the name. I have to get this one right. Suchitra, right?
You got it, Claudio. You always do.
Oh,
Don't
you're
worry.
being too kind. We're in
I
the
respond
Lenten
to pretty
season.
much
You're being
everything,
very
so-
forgiveful. That's good.
No worries, that's good. So I was pretty much going to say the same thing that Commissioner Jotani said, which is the delay is also an issue which seems to have contributed to some of the numbers we see. The other thing, to follow up on what you were asking, Stephen, is the huge increase in e-cigarette use has really been shown to be related to the Juul epidemic, and then which peaked, and then it's been a drop after Juul took a lot of their flavors away, and a lot of regulations were put into place. It really led to a huge drop in youth use. So that's the point. But the question that I was going to ask Shruti, and thank you for that excellent presentation, by the way, was nicotine pouch use assessed by the YRBS in 2023? Do you know?
Yes. In 2023, nicotine pouches was also asked in BRFSS. And the data is available on DPH website individually in adults and the youth high school students as well. And the data also presents information on race and ethnicity, sexual orientation, including LGBTQ and poor mental health as well.
I see. And the rates were pretty low, if I remember correctly, right?
Yes.
Yeah.
Yes, they were really low. That's why we did not present that in the presentation, and we did not include that in the fact sheets as well.
Right. Okay.
Yes.
And I have one last question, if I can, Claudio. So it's more, this is such excellent data. I was just wondering if this would be the appropriate place to ask about if Commissioner Jatani or anybody else knows what the plans are for continuing YRBS, considering that OSH has been removed from CDC, the Office of Smoking and Health. They are the ones who do YRBS. So do you know what the plans are for the upcoming year for continuing that?
So we've been in regular contact with our CDC colleagues. And as you mentioned, the Office of Smoking and Health has been RIFT, or reduction in force, the entire group. We received a no-cost extension on our grant with information to say that they will let us know when they have more information. In speaking with CDC colleagues, they do not know if that work is going to continue or not. They do not know if that work is going to be transferred to the new agency where some of the chronic disease work seems slotted to go. And they are unable to answer any questions because all of the staff that used to work on tobacco have been RIFT.
Right.
So their answer is that they don't know.
Thank you.
Thank you. Representative Harrison.
Thank you for all this data. I think we've all been craving it to, really get some answers. And I think what we need to probably, it's just more of a comment than a question, is realize going forward how much of our dollars we probably need to use to target our youth. Not if they don't start, that's our best form of defense than getting them to cease. So that's more my comment and what this data shows for some of our thoughts going forward.
I'd just like to say that in this time when healthcare is expensive and difficult to cut because people need it, part of what we are seeing is that a lot of prevention efforts and prevention dollars are being cut. And so I appreciate your comment. I just want to recognize that as a public health department, I mean, that is primary prevention, right? Secondary prevention is trying to get those to stop who've already started and beyond, and tertiary prevention is trying to prevent lung cancer and the outcomes once you have it. Primary prevention is trying to help them stop in the first place. And it's harder to see the benefits of primary prevention, but that's what we do at DPH every day. And I think that I agree with the idea that if we can target our youth, it would be a good use of our resources. I agree.
I guess somewhere along the way, what we have to identify is it's just not a cool habit, right?
I think one of the things that the data showing the tremendous decrease from 2011 to now in cigarette use, actual cigarette use, that campaign has been extremely effective, that cigarettes are not cool, right? But it is where we are challenged is the other areas, the vaping, cannabis, the other, potential opportunities. So it has been actually a very, very successful 20-year CDC campaign to make cigarettes not cool among youth. But we have to do that more broadly. Sorry, Sruti, you wanted to say something?
Yes, I wanted to quickly clarify on nicotine pouches. And sorry, the nicotine pouches current usage every day, some days or not at all is included in 2025 BRFSS survey for adults and YRBSS for high school students. And in YRBSS high school students, SLTs, NUS, dissolvables, lozenges, current usage patterns were included in 2023. Those numbers were sample size was less and the numbers were not so high. That's why they were not included in the fact sheets and presentation. I wanted to quickly clarify. Thank you.
Thank you. Excellent. Dr. Hahn.
Thank you. That was a tremendous amount of data. So thank you very much. A question about the shifts in usage rather than just the actual numbers. I don't have all the numbers in front of me, and obviously there was a tremendous amount of data presented. Do you think that there was a sizable, with the decrease in the cigarette use, did those users simply switch to vaping, or do you think these are new users coming in as using e-cigarettes, and that there was an actual quit rate? I know it can be hard to tell from this data, but what are your thoughts or insights on that?
We do think that the decrease in cigarette usage, cigars usage is now changing to e-cigarette usage, and the trends are currently changing to e-cigarettes and other electronic vapor products usage. And the vaping devices, they are pretty, I would say, common now after COVID, and that's why the trends are changing from conventional cigarette usage to electronic vapor product usage. And we believe that, and might want to work more on it and include more questions on vapor related questions in the next BRFSS and YRBSS surveys. That's a great point. Thank you for noticing that.
Suchitra.
To make one follow-up point to that earlier question. So just to clarify, this is not based on Connecticut data, but the national data that I've seen, most youth start with vape products. So it's not that they're switching from cigarettes to vape products. Yes, there are some adults who are switching from cigarettes to vape products, but most youth don't start with cigarettes now. So the switch issue does not apply to them.
Good point. Well, this was really fantastic. I don't see any other questions up, but I think it's so important to anchor our work. We've always sort of wanted to be very committed to making sure that the investments and the funding we have and being good stewards of these dollars means making sure that we're looking at the data and pointing interventions where they can have the highest impact. And presentations like this and getting the subject matter experts from DPH is really incredibly important. Commissioner Giuttani.
I just wanted to take an opportunity to also introduce Amanda Fata, who I believe is on the call as well. She is an HPA funded specifically through the trust fund funding to be able to help do this work, executing the contracts, getting the work going that the trust fund has been working on. So it's been a great addition for us to be able to have her on board and be able to move this work forward. So Amanda, I don't know if you want to just say hello and for the group.
Sure. Thank you, Commissioner. It's great to be here. Yeah, I joined the team. It'll be 3 months tomorrow, working with Allison and the rest of the team. So yeah, thank you for having me. Welcome
on board. I actually think I want to close out this section by just putting a thought that we're going to have to revisit after the session concludes when we see what funding the Tobacco and Health Trust Fund has moving forward for the next biennium. But it does occur to me that there's a lot of disruption happening at the federal level. And to the extent that we have an opportunity through the trust fund work to make sure we're shoring up and fortifying existing program and staff that work on collecting critical data that's informing us, we may want to consider pivoting away from a complete RFPing of the body of dollars we have and sort of investing in what we know works and has a track record so we don't backslide. I don't want to make any, commitments now not knowing what we have, and obviously we'd have to talk through it as a board, but I did want to socialize that idea that that's part of the flexibility we may have if we're fortunate enough to continue to have funding in the Tobacco and Health Trust Fund Board. With that, I'll move to the next agenda item, which is just teeing up what may be the next items we talk about in July. So in July, hopefully the budget process will conclude. The session is set to be done on June 4th. So our expectation is that we'll have an approved state budget. We'll have clarity on what type of deposits will have been appropriated and resourced in the budget, and an expected timeline for how to move forward with that work. We may at that time also have a clearer picture of the federal process as they work through their federal reconciliation package and federal budgeting process. And we will obviously continue to get updates from DPH on the existing allocation plans, the contract development work, and how money is proceeding out and getting to community. The other item that we'll talk about is whether we could potentially get any of the vendors to come and do a deep dive. I know we did an iQuit presentation, the Quitline presentation with our new vendor, and the board really seemed to enjoy that, and it gave some tangible details of where the funding was going and how it was directly impacting communities. So we're hopeful maybe we can get a vendor that's been awarded funds to talk through their work progress to date and some of the metrics that they hope to achieve. The last thing is we will start to initiate some conversations and maybe plot out a set of timeline for our next allocation plan. What dates we want to hit and what meetings we can commit to getting an iterative process and making sure that the allocation plan can be put forward for legislative approval. Any questions or requests for topics on our next meeting in July? Seeing none, our last substantive item is public comments. I know we have at least a couple people from the public here, so I do want to pause to see if they want to offer any comments at this time. Seeing none, Dr. Salner, go ahead.
Claudia, just to throw out as a possible topic for the next meeting, since you brought up the issue of changes in federal support. Our federal support, I assume, helps to support many of our programs at DPH, and tobacco programs are included. And it would be interesting to know if this could be shared. It'd be interesting to know, because we may have to act on it, where this federal support is for the tobacco control program, so that maybe we can help support those if the federal government stops supporting them.
I think that's a smart idea. And I think that we could take it back. And I think, how we've tried to approach it, just by way of reference, OPM has created a portal. So as we get information on any federal grant, we've committed to once a week updating that portal. Melissa, I can share with you that link if you don't have it, and we can make sure this group has it. So anytime folks want to check, even beyond just DPH, obviously DPH is very much impacted, as our DEEP, our Environmental Protection Agency, tends to have the most disruption at this point. But I imagine as different cuts are contemplated, they'll be cross-cutting across several different agencies. So we will make that resource available to folks. And I think it's probably good to take a pause, provided that the federal government will have a clearer picture and look holistically at what does the picture look like in terms of federal resources, and where does it intersect with our work. Thank you. Good suggestion. All right. The only other item for public comment is the House Public Health Committee Chair sends her regrets. She was not able to join us. She would have been here for the meeting today, and she did ask that I just quickly note some of the legislative stuff that's happening. I know that our team here, separately from our day jobs, often likes to follow the legislative process, and so she asked that I highlight a bill that was heard for public hearing in the Finance Committee, 7275. It includes some additional enhancements on tobacco regulation and enforcement. And in particular, both the House and Senate public health chairs jointly testified and took questions, requesting that the Finance Committee not only approve the bill and supported the several provisions of the bill, including enhanced ID checks, for closing certain loopholes for not traditional cigarette products. But they also made a request that ZYN and other certain products that are nicotine based or synthetically based in labs would also come under the cigarette tax that Connecticut has. So I did want to make that point of reference if anyone wants to follow that bill. Again, it's House Bill 7275. And you can look at the testimony, including the testimony of the public health chairs. And we will obviously, at some point in the summer, do a recap of major legislation and policy that passed in the session, and as an FYI to this board. The other related legislative item, we did put forward at the board's suggestion some language that would have modified and given us additional flexibility to adjust allocation plans. That was not approved in the Human Service Implementer Bill that came out of committee. It still is a topic for discussion. I think probably they're going to want to see some quantifiable effects of not having that flexibility. So I think as we go through the contracting process, if we can demonstrate that the flexibility to pivot between line items would have been more helpful in actually awarding the highest scoring projects, that might help us come back to that policy change in a future year. With that, I will entertain a motion for us to adjourn 23 minutes early.
So moved.
Dr. Salner, seconded.
I'll second it.
Second by
Ian
Ian
Foley.
Foley. All those in favor of adjournment signal by saying aye. Aye.
Aye.
Aye.
Any nays? Any abstention? We are adjourned. Have a great week, everyone. Talk to you later.
Aye.